What does it cost on average to acquire a new patient at a dental practice? In other words, let's say you're looking to increase your patient flow, so you're trying a bit of marketing, maybe flyers or social media or maybe some SEO. How much money do you have to spend on these activities on average until you get one new patient in the chair? We constantly see dentists throw money at all kinds of random marketing activities. They're doing flyers and social media, billboards, they sponsor a Little League sports team, they take out ads in the newspaper, they try Google AdWords, they try all kinds of random things. However, when we sit down with dentists and ask some basic questions like, what is your cost per new patient lead? Or what is your cost per appointment? Or what is the return on investment from all these random things that you're doing? They generally have no idea. When we ask them why they're spending money on all these things if they don't know any of these numbers, the typical answer we hear is, well, I was just trying to see what works. Pretty much everything out there works to some degree. The question is never, does it work? The question should be, how well does it work? And in other words, how much do I have to pay to acquire a new patient using this strategy? And how well does it work compared to everything else I could be doing? You need to remember that while you're trying to get new patients, so is every other dental practice in your area that you're competing with. To beat your competition, you generally have two options. Option one is you could spend more money than everyone else. If the average dental practice in your area spends $2,000 per month on marketing, let's say, then you could spend $10,000 and that's going to give you a big advantage. Option two, however, is you could spend your money in a much smarter way. If other dental practices in your area are throwing money at all kinds of random marketing strategies without a lot of thought and they have no idea what any of the numbers are, while you instead are investing your money into only a few very specific strategies that yield the highest return on investment because you're tracking the numbers, you're also going to have a big edge over other dentists. Other dental practices, they may be getting 2-to-1 return on their investment on their marketing dollars spent, while your practice generates 10-to-1 return on investment. In other words, your dental practice may be able to acquire patients at only a fraction of the price that other dentists in your area are paying. Generally, it's better to go with option two and spend your money in a much smarter way. But how exactly do you do that? Well, you need to track your cost to acquire a new patient using different marketing activities. Based on my experience, by looking at the numbers for different dental practices before we started working with them and taking over their marketing, and based on speaking to other dental companies that track financials like dental accountants, dental brokerages, etc., the average dentist in North America is spending somewhere around $400 to $500 on marketing to get one new patient in the chair. Now, this may seem quite high, and for many dental practices, they're actually spending even more than that, but they don't realize it. Here's how this normally happens. A dentist may be doing a flyer campaign, for example. So let's say they spend $2,000 on flyers. They don't track exactly how many calls they got every time they do the flyer blast. At best, they may sort of track how many patients they got from it, but I have never met a dentist that could pull up exact stats from a flyer campaign they did 6 months ago and tell me exactly how many people called, exactly how many people booked, and how much money those new patients spent with the practice over the resulting 6 months. However, we do track these numbers, and often what we find is that on a $2,000 flyer blast, for example, the average practice may only get 5 or 6 phone calls from new patients. And out of those, only 2 to 3 may actually book an appointment. So essentially, they're spending $300 to $400 just to get a phone call from a potential patient and around $700 to $1,000 to get a new patient. And when we show dentists these numbers, they're usually pretty shocked. And we explain to them that this is why most marketing companies, especially older paper-based marketing companies that do flyers or newspaper ads, why they never track these stats for you. It's not because they can't or they don't know how. It's because they know what they would find out, and they know that if you knew, you would never do business with them again. Now, this isn't to say that older traditional paper-based marketing doesn't work, but digital marketing works. We see the exact same problem with digital marketing as well. When we asked them what their stats were, like cost per lead, cost per patient, they had no idea either. In fact, not only did they not know, neither did the marketing companies that they were working with. They weren't tracking any of these stats either. Clients kept doing it because they did see patients coming in and they thought like, hey, I guess it works. I heard a phone ring yesterday and the patient said they saw our Facebook ad. But nobody was actually tracking exactly how many patients they were getting, or how many new patients were calling, or how much money they were spending on those Facebook ads, or how much money those new patients were spending with them, or really what their return on investment was at the end of the day. Now, does this mean that marketing just doesn't work for dentists, or it's just a waste of time or a waste of money? No, absolutely not. What a lot of dentists don't understand is that the results you get from different marketing activities largely depends on who is doing the work, how experienced they are, how much time and effort they're putting into it. So for example, when we work with a new dentist, we're generally able to get them new patients somewhere around $200 to $250 per patient in the first few months. As we keep improving the website and the campaigns over the next 5 to 6 months to really tailor their website and their campaigns to the types of patients that they're looking to get, or the types of patients that are in their area, we're able to get them new patients for maybe $100 to $150 per patient. In fact, we also have clients that we're getting, new patients for $50 to $75 very consistently if they're in a low competition area. Now, how are we able to do this? Well, you have to remember that all these different marketing elements like your website, your Google AdWords, your Facebook, they're all just tools. Think of it like a golf club. If I was to give you the same golf club that Tiger Woods uses, would you be just as good of a golfer? Would you get the same results? No, obviously not. It's not the tool that gets the result, it's the person or the team behind it. The exact same thing happens with pretty much any marketing activity that you could be doing, whether it's Google AdWords or social media or paper advertising. Just like two people could use the same golf club and get very different results, two companies could also do Google AdWords and get very different results. The process, the talent, and the level of effort that goes into the work is largely what determines your return on investment. As a dentist, as a dental practice owner, what you need to do is to keep score. You need to figure out how much money you're spending, how many calls you're getting, how many of those calls are actually turning into patients, how much those patients are actually spending with you on their first visit, in their first year, through their lifetime of being a patient at your practice. And most importantly, you need to figure out what is your return on investment. How much money did you put in and how much money did you get out? If, for example, you want your dental practice to grow at, let's say 3 times faster than other dentists in your area, but you don't want to spend 3 times as much money as what other dentists are spending, then you need to track your ROI on each marketing activity or each marketing campaign or each marketing company you're working with, and invest your money in the one that generates the highest return. You need to stop doing all kinds of random things and throwing money at the wall to see what sticks, and instead put your money in the marketing activity or the marketing campaign or the marketing company that generates patients at the lowest cost per patient. And once that's saturated, you put the remaining money into the second best option and then the third best option and so on and so forth. It's like investing. You put your money into the investment that generates the highest return. If my investments generate 8% return and yours generate 3% return, who do you think is going to come out on top in 10 years? It's pretty simple when you think about it, but 99% of dentists don't think this way when it comes to marketing. Their strategy is just to randomly try a bunch of different things to see what works. And this is like someone trying to make money, and one week they're buying scratch and win lottery tickets. Next week they're going to the casino to play roulette. Next week they're trying something else. And when you talk to them and you ask them, what are you doing? They respond with, well, I'm just trying to figure out what works. This just is not a recipe for success if you're trying to do marketing or if you're trying to attract new patients. I hope you found this video useful. If you want to get more content like this, consider subscribing to our YouTube channel or visit us at revupdental.com. Thanks for watching.